Thanks. This is Kyle from the Idaho Falls Post Register. I wanted to talk about where we are in vaccine distribution. I'm wondering, when will supply exceed demand in Idaho, and what will that look like?
Well, I'm going to pull the director in here as well to answer. I'll start out. We certainly are seeing some of that in some parts of the state. We've talked about in the past that some of the demand has been dying down, but supply is continuing to increase. That's one of the reasons why we made some of those decisions about opening up to different population groups as quickly as we have. What that will look like, I think you'll see, more appointments that are available than we have people filling those appointments. So we want to do everything we can to make sure that we're making it very clear to all Idahoans who either live or work here who want the vaccine can get the vaccine. We want to be able to address their confidence in the vaccine, help assure them that it's safe. It's an effective way of helping to get us back to normal with our pandemic situation. And so we are, as we, I guess it was not in this call, but it was in a different call. We talked about there are new media and marketing campaigns that are have been launched already. We want to make sure that we are getting those messages out to the far reaches of the state to help people build that confidence. If they're thinking about it, if they're watching and waiting, trying to make those decisions. So driving that demand is going to be super important for us to be able to do. And I'm going to turn over to the director to see if he has anything else he wants to add.
Thanks, Elke. You covered that very well. The only thing I would add is right now we see people coming to the vaccine. And once we get to the position, as I mentioned at the beginning of this call, we're now at almost 83,000 first doses a week coming in the state. We'll soon be in a position where supply may exceed demand, maybe within the next 4 weeks or so. And when that happens, we will probably see a switch where we'll be moving to try to take the vaccine to the people. And as you heard Elke describe at the beginning of this press briefing, the health districts and the vaccine providers are already working on a multitude of strategies of how they take the vaccine to where the people are to make it really easy. We know there's two types of folks that will probably be last to get vaccinated. One is, I think I call them the busy parents. I might call them the busy people category that are just have busy lives and will want it to be really convenient. And the Johnson & Johnson vaccine will be really helpful, particularly if it's at a place where they frequent or a place that's convenient for them. And then there's those that are waiting to see. And again, we want to make that particularly convenient at a healthcare setting, whether that's the doctor's office or the pharmacy. So I think we'll see a change in distribution strategy and a change in focus on getting the vaccine out to individuals.
Hi, Melissa Davlin with Idaho Public Television. This might be a question for either Elke or Sarah. And by the way, thank you so much for bringing the examples of the efforts that public health districts are doing to get people vaccinated. I was curious if the state is still tracking wasted doses, and if so, is that percentage still as low as it was early on in vaccine distribution?
Yes, great question. And we love answering this, Melissa, because it is incredibly low still. And I know that Sarah can give you the more specifics.
Yeah, I'm really excited about this number as well. We are, and we think that there may be more than this, but providers are required to report their doses in a federal system. And so right now, there are recorded 926 wasted doses, which is less than 0.1% of the total doses that have been delivered in Idaho. So that's a really great wastage. Of course, we don't want any doses wasted, but we know that that's going to happen. It's the nature of administering vaccine. But that number is a really good number.
Just a quick follow-up. Does the state follow up with any of those providers and find out if there are some providers that are more likely to see, even if it's a very small number overall, if there are providers that are more likely to have wasted doses, or what the circumstances around that waste might have been?
Yeah, it's a great question. There are a number of reasons why doses have to be recorded as wasted. Some of them are just, they're an open vial. There were not enough folks to administer the remaining doses in a vial. Some of them are once the vaccine is delivered to a provider, when they unpack the vaccine from the shipping containers, they have to examine the box and the vaccine vials. And there may be a broken vial. There may be the seal around it might not look right, and an abundance of safety, that vaccine needs to be reported as wastage instead of using it if that seal doesn't look right. And then just if there's leakage sometimes around the vial, again, that would be in an abundance of caution. We would ask the provider not to use that vaccine if the seal isn't really holding securely. And so, any number, they might drop a vial by accident. So there's a lot of reasons. Yeah.